I have no financial conflicts of interest to disclose. Strabismus surgery is more variable than we like. The authors have looked at factors other than the angle of misalignment that may influence the variability of the outcome. I consider this a noble undertaking. They analyzed 342 cases of surgery done by a traditional formula, from which they identified 4 factors that they feel affect the outcome. They then used these data to generate a formula that they subsequently used on 724 cases and had a better outcome with the new formula. I have a few comments about the results. First of all, this was a sequential series, and as we know, a randomized series would be better, but I think that it is still good that they used one group to define their formula and another to test it out. Their outcome criteria for success was plus or minus 10 prism diopters. Many people use that. I think it's not ideal, in my opinion. The outcome determination was 6 months after surgery in all patients, and I think it's good that they were all evaluated at the same time after surgery, rather than as of last visit. 6 months may be okay for a short-term study, and I would consider that acceptable. But the biggest issue I had is they did not routinely correct hyperopia fully in esotropic patients, and I think that this makes the final outcome a moving target that, excuse me, may deteriorate under time. And notably, the surgery was almost all muscle plication, with recessions being rarely incorporated, which differs from many people's standard of care. Still, I think the results they presented were impressive. Now, I have some comments about the theory behind the calculation of this formula. The model that they used is based solely on what I'll call anthropomorphic or geometric factors. Torque, as we know, is the force times the lever arm, and they focus mainly on things that'll change the lever arm. Muscle stretch and shortening alters the force in the muscle, and this was not really taken into account. Now, hyperopia, one of the variables, could be a surrogate for axial length. Bigger eyes are less hyperopic. Accommodated convergence, high ACA, we know already affects the outcome, but they determined the ACA ratio testing patients on a fixation light without fully correcting hyperopia. So I'm a little suspect of the validity of those data. Axial length has previously been shown to affect response, but interestingly, when I did my own investigation in this, the effect was much less than expected, and I'll say why in a minute. And interpupillary distance, although theoretically would have an effect, if you calculate it, I don't have time to do this here, a 1 centimeter change in IPD will affect the deviation by 1/6 of a prism diopter, which incidentally would be picked up on the measurement if you can pick up such a small deviation. So axial length makes sense in a way. We can see that a bigger eye, more millimeters of movement is needed along the circumference. You can see that in the left hand of the picture to subtend the same arc. But I think that the arc of contact change is not the main effect of surgery. If you look at the picture on your right, you see if we move a muscle and we're anterior to the equator, we don't really shorten the lever arm. And it's mainly the sarcomere change in the muscle itself, tightening or loosening, that really affects our result. It would have been interesting if the authors told us the range by which their surgical formula differed from what the standard formula would be. In other words, how different is the formula really? So why is surgery so variable? I think that there are factors we cannot quantify yet. Variation in muscle innervation, tonus, muscle stiffness, muscle strength, fiber type, cell type, I think all play a role. So in conclusion, I'd say there are certainly factors other than the deviation that influence strabismus surgery. The authors have possibly identified some of them. Some are ones we do not currently have a way to assess. I'd like to thank you, and I'd like to thank the authors for providing me with this paper well in advance, and for the nice assortment of Russian vodka and caviar that I found in my room last night.
The next paper, localizing